behavior. For that reason, we plan to build a forest retreat center in Citta, Sri Lanka. We will introduce the early Buddhist teachings-based mindfulness programs to local and international practitioners. Additionally, our center will perform palliative care service for cancer patients. We propose to provide Buddhist mindfulness-based group counseling to cancer patients at retreat centers, hospitals, and caring houses. Moreover, we expect to give monthly online public lectures on Buddhist psychology, psychotherapy, and counseling. Today, we are discussing on Dharma therapy for schizophrenia. Together with Professor Vasanta Prayatashjala, we invited other speakers for today. First, I'd like to introduce Professor Vasanta. Professor Dr. Vasanta Prayatashjala was born in Sri Lanka. He joined the University of California and earned his bachelor's degree with first-class honors in the year 2000. He earned his MA degree at the same university in 2002. Professor Vasanta obtained his PhD at the Postgraduate Institute of Pali and Buddhist Studies, University of California, with the dissertation entitled Therapy of Mental Diseases, a study of psychoanalysis and behavior therapy as depicted in Tipitaka literature. In 2002, he started his teaching career at the University of California as a temporary assistant lecturer for the Department of Pali and Buddhist Studies. He became a permanent lecturer at the Buddhist and the Pali University of Sri Lanka from 2005 to 2009. In mid of 2009, he moved to the Postgraduate Institute of Pali and Buddhist Studies, the University of California, as a senior lecturer. In 2016, he was promoted to a professorship. He was teaching as a visiting professor at the Center for Buddhist Studies, the University of Hong Kong, the Buddha Dharma Center of Hong Kong, and several Buddhist universities in Myanmar. Currently, Dr. Vasanta is a professor in the Department of Buddhist Culture, the Postgraduate Institute of Pali and Buddhist Studies, University of California. Dr. Vasanta's research fields are Buddhist psychology, Buddhist counseling, and Buddhist psychotherapy. The next I would like to introduce with you is Dr. Gordon Ong. Dr. Gordon Ong is a specialist in psychiatry and also an honorary assistant clinical professor at the University of Hong Kong. Dr. Gordon Ong was born in Hong Kong, but spent his formative years in the UK. He completed his medical school in the University of Hong Kong. He is a fellow of Royal College of Psychiatrists in the UK, and is also a specialist in psychiatry in Hong Kong. His law in private practice in Optimum Clinical in Causeway Bay, Hong Kong. He is interested in various methods of psychotherapies. He received training in cognitive behavior therapy, mindfulness, acceptance, and commitment therapy, and hypertherapy. He also holds a master's degree in counseling studies and another in public mental health. He is currently studying Masters of Art in Buddhist Ayurvedic Counseling in PGIPBS, University of California. The last speaker that I need to introduce with you is Venerable Lambda Chala. Venerable Langdachara is a Theravada monk from Myanmar. He ordained a monkhood since 2017, and he is studying Buddhist studies. Venerable Langdachara studied at the MA Buddhist Studies at the PGIPBS and on Best Performance Award and Academic Excellence IPANI in 2019. He studied MA Buddhist Ayurvedic counseling class at the PGIPBS as well. In 2021, he received the glorious Sun Foundation Scholarship and he studied the Master of Buddhist Counseling at the University of Hong Kong with 4 scholarships. Venerable Langdachara is also studied diploma in psychology at the American College of Higher Education in Sri Lanka. He published 4 books related to Buddhist psychology in Burmese language. He is research under the supervision of Professor Wasanda at the PGIPBS Law. Okay, now I'm going to introduce today's outline. It includes 7 parts. The first is Dharma therapy is Buddhism, which lecture from by Professor Wasanda. The second part is Schizophrenia, were delivered by Dr. Gordon Wong. The third part is Dr. Nisanka, Buddhist Psychotherapy and Schizophrenia, which will be delivered by Venerable Langdachara. The fourth part, Buddhist understanding on psychological sufferings. This also will be delivered by Professor Wasanda. Actually, the fourth, 5th, and 6th part will be discussing by those 3 guests. So the last part is the question and answer section. Okay, now I would like to invite the speaker to take over the floor. First, invite Professor Wasanda. Professor, please.
Okay, Venerable. Can I share my PPT, PowerPoint? I think you'll let me allow to share my PPT. Okay. Okay. Good afternoon, good evening, and good morning, because we have a lot of participants from every nook and corner of the world. So my part is to explain you what the Dhamma therapy is in Buddhism. Well, so as far as the concept Dhamma therapy is concerned in Buddhism, we have a lot of evidences to explain what the Dhamma therapy is. I would like to draw your attention at the outset into very specific sutta, that is Samanya Phala. In this very specific sutta, there's a very good classic story of moral anxiety patient, King Ajasattu. Being infatuated by libido, he really killed his father. After a little period of time, he got kind of a psychological illness that can be named as moral anxiety. Then he was given kind of therapies by a lot of kind of religious teachers, but no effect. Then finally he was directed to the Buddha by his royal physician Jivaka. Then when we look at this process, the process means the Dhamma therapy process, how Buddha used his Dharma therapy to heal this moral anxiety issue. It's very interesting. So King Ajasattu, he explained what he really did. We know that at the very beginning, he did not want to openly explain what his issue was. But Buddha, knowing it, Buddha used his methodology. Buddha led the king to come up with kind of issue, come up with kind of questions and some concepts. Then really Buddha led the king to come up with internal worries. Then king knew that Buddha has the good pathway, good methodology to heal his issue. Then he really explained his real issue. The real issue is that he killed his father. After that, he was really shocked by this immoral act, practiced act. Then he got this issue. Then Buddha says in this context that if you really accept, if you really understand your issue as it is, we are all ready to help you to get rid of the issue. What is this methodology? Yata dhammang patikaro. In Pali, it is explained there that if we are all ready to get the amendment, if we are all ready to get rid of the issue with the help of the Dhamma, so we can heal it. So at the outset, I would like to introduce you that there's a very good methodology in Buddhism to deal with the psychological issue. This methodology could be further renamed as therapy in Dhamma, Dhamma therapy. So I would like to further explain this process of Dhamma therapy. So when we pay our attention to the another classic story, this is the classic story of psychopathy Angulimala. This is the classic story, psychopathy Angulimala. He had kind of antisocial behavior. So this is the antisocial behavior. When it comes to the antisocial behavior, we know that these kinds of clients are more egocentric and having antisocial activities and lack of remorse for one's action and absence of empathy for others and open criminal. So then we can, in short, we can say that he's really a kind of antisocial character, serial killer. In short, serial killer. So then, how Buddha transform this serial killer's brain into the Arahant brain? We know that in this sutta, it is very clearly stated thereof that Buddha totally transformed this serial killer brain into the Arahant brain. What is the methodology Buddha used? In a neuropsychological sense, this methodology is graphically explained in this sutta. In short, irrigators, when you read the end part of the sutta, the methodology is nicely explained thereof. Irrigators guide the water. To guide the water, for the water engineers to guide the water, to channel the water, there should be a systematic way. Fletchers shape the arrow. We know that to shape the arrow, there should be a strategy. Carpenters, they know that. They know the way to change these hard woods into very beautiful furnitures. Then the wise, they control themselves. So if you can be a wise person, you can change your immoral brain into moral brain. This is the methodology. What is this methodology? These strategies, this methodology is encapsulated in threefold training. So earlier we can see that he gave a lot of disturbances to the society as the antisocial behavior, serial killer, He totally changed the entire social well-being. So we know that in the Buddhist context and in the modern context, we know that the well-being, the social well-being is dependent on the well-being of an individual, vice versa. Then as a result of being an antisocial character, so the society, they lost the social well-being. Then this person came into a serial killer. Then how with this process Buddha change his brain? So after changing this serial killer's brain, he became an arahant. Earlier, he gave a lot of social disturbances. Now, he productively brings about more benefits, more productions towards the society. Addressing a labor pain lady, in this story, it is clearly mentioned thereof that a kind of a lady, she had been suffering from a labor pain more than 1 week. Addressing to that lady, what the Arahant Angulimala says, sister, since I was born in the noble birth, everybody has the ability, potential to reborn in a noble birth. I do not recall intentionally killing a living being. Earlier, he killed more than 999. But after reborning in a noble birth, I do not recall intentionally killing a living being. Through this truth, may there be well-being for you, well-being for your fetus. So then there are more evidences in the psychology of Buddhism to find out a systematic strategy, systematic way to heal those kinds of psychological illnesses. Today we are going to concern how this Dharma therapy could be applied to the schizophrenic issues. So then firstly, my duty is to emphasize here that there are very strong therapeutic elements in the early Buddhist teachings to rename or define as Dhamma therapy or therapy in the Dhamma. So these are the two kinds of classic examples, but there are more examples. But I think it is very enough to understand the main theme, what the Dhamma therapy. So there are kind of such. So then this is the whole scenario of Dhamma therapy, according to my research. So in this Dhamma therapy, there are three main elements. First is the exhortation, advice therapy. The main objective of this exhortation is to understand the entire issue, every nook and corner of the issue. Dhamma patikara, Ovada patikara, advice therapy. So there is a very specific point here to be understood. Within the Buddhist context, the issue is not neglected. It means we are not hiding the issue in front of the client. Entire aspects of the issue, every nook and corner of the issue should be explained to the client without damaging to his personality. We are not trying to bring the client by force in accordance with the wants and needs of the society. We are not going to transform the client according to the wants and needs of the society. It is to be understood. We are really explaining the real issue to the client without damaging. This is your entire issue. After that, assistant. So sometimes the clients are not all ready to accept the issue due to the fight and flight tendency or self-defense mechanism. But we are helping them, assist them to accept, and we give kind of psycho-education for them to recognize the issue and to get rid of the issue. These three things are very comprehensive. I think I need 1.5 years to explain these three concepts, because throughout our master degree in Buddhist counseling, we are explaining it. But in short, there are three components. But these three components further should be carried out through this process, listening. We are listening to the client's complaint. We are letting the client to have a noble vomiting, noble purgation, noble catharsis. Then retention. As the therapist, you bear it. You bring what the client vomited into the therapeutic setting. Normally, I'm explaining this is therapeutic reading. You just listen. Now, through your language, through your experiences, you are trying to understand the issue. Then memorizing, it means you are study from outset into the end, from end to the middle. Every nook and corner of the issue is to be fully studied by the therapist. Then you can memorize it. Then this is the recognition of the issue actually, whether it is psychosis or neurosis. Then visualizing. This is very intrinsic, significant point in Buddhist Dharma therapy. It means now you take the issue into your conceptual, into your mind, into your own conceptual world, visualizing. So you are not depending on what the client said. You are not depending on your therapeutic reading. You are not depending on the understanding on psychosis and neurosis. You yourself try to understand by your own intuition and insight what this issue is. If there are any mistakes, then you can make them corrected through the visualization. Then finally, you come to the clear comprehension. This is the real issue. To carry on these things, you need counseling ethics. So we follow 4 sublime abodes as the Dhamma therapy, in the Dhamma therapy as the counseling skills and ethics. By using this process, we are listening to the internal worries of the client, which are in conscious and unconscious level. Then with the threefold training, we are going to reconstruct the personality. According to Buddhism, everything is impermanent. There shouldn't be permanent psychosis or neurosis or schizophrenia. Everything can be amended. So once Buddha taking very few, turning dust into his finger and pointing it to the venerables, mentions that there is not this sort of little tiny portion of dust in the, like this portion, no, this sort of tiny portion in the personality factors that cannot be changed. It means, in short, everything can be changed. The brain can be reconstructed. Personality can be reconstructed through behavioral, emotional, and cognitive transformation. How it can be done? By the threefold training. So this is the Dhamma therapy, what I really want to explain in short. Then we can listen to our next presenter. I think Eva will explain. Eva, can you introduce that? I think you muted, Eva. You muted. You muted.
Okay. Thank you so much, Professor, for your wonderful lecture. Now I'm going to invite Dr. Gordon Wang to deliver a lecture about schizophrenia in the wisdom perspective. Dr. Gordon Wang, please.
Sure, thank you, Eva. So now I'd like to share my screen and I hope you can see my screen now.
Yes.
Yes.
Thank
okay.
you. Thank you. So a very good afternoon to you all. I'm Gordon Wang. So today I would like to talk about the schizophrenia in a Western medicine perspective. So schizophrenia is a type of psychosis. There are many different types of psychosis. There are many different causes, and schizophrenia is one type of psychosis. Schizophrenia is characterized by hallucinations and delusions, which I'll talk about in a moment. Schizophrenia is different from other types of psychosis because the cause of schizophrenia is unknown. So the diagnosis is made by clinical presentation according to set guidelines. The guidelines are mostly dividing the symptoms into different categories. The most common categories are positive symptoms and negative symptoms. Positive symptoms meaning that there are phenomena which are present but shouldn't be there. For example, hallucinations. There can be delusions, disorganized thinking. These should not be there, but they are there. Then therefore, it's called positive symptoms. And so then I will define the hallucinations. So I know some of you are interested in what hallucinations are. Hallucination is defined as a perception in the absence of any stimulus. So it means that if you hear something, but in fact there is no sound, then it is a hallucination in the auditory modality. A hallucination may not be just auditory, it can be visual, it can be olfactory, it can be tactile. So there can be various types of hallucination. For delusions, delusion means a strongly held belief which is unshakable, meaning that you can't convince the person to believe that it is actually not correct. It is an unshakable belief which is out of keeping with the local cultural beliefs. So common delusions are persecutory, meaning they believe that someone is harming them, wanting to kill them, or they can be referential, meaning that they believe people are staring at him or laughing at him, talking about him, when in fact these are not actually happening. Disorganized thinking, so the thinking pattern is very unpredictable. So this can be manifested in various ways, which we'll talk about later. And then the second type of symptom is negative symptoms. So negative symptoms is symptoms that are there but shouldn't be there. So negative symptoms mostly involve loss of volition. People with schizophrenia who have negative symptoms, they don't want to do anything. They can literally sit there for the whole day. They don't want to do anything. They have no motivation, no volition. They also have diminished emotional expression. It means that their facial expression is very flat. It looks like as if they don't have any facial expression. So that is a negative symptom. So the criteria we use to diagnose schizophrenia, there are two different criteria that are mainly in use in the world. One is called the DSM-5 criteria. So in this DSM-5 criteria, schizophrenia is defined as 1 month or more of 2 or more of the following 1 to 5. So delusions, hallucinations, disorganized speech, disorganized behavior or catatonic behavior, or negative symptoms. So any 2 of these 5 categories of symptoms, then it is defined as schizophrenia. And then the other criteria is called ICD-10 criteria. So ICD-10 criteria has to include one of the following. In number 1, it has to have thought echo. It is a type of hallucination where the sound says whatever that the person is thinking. So the thought, when there is a thought, then the sound says the thoughts out loud. There can be thought insertion, thought withdrawal, thought broadcasting. This means this is collectively called thought alienation. Thought insertion is when there is a thought in the brain which is recognized as not my own, but as if someone has put a thought into my brain. Thought withdrawal is the other way around. Someone has taken my thoughts away from my brain. And thought broadcasting is when I haven't told any other people about my thoughts, but people know my thoughts, as if my thoughts has been broadcast to other people. And then delusions of control. Someone is controlling my body, my thoughts, my feelings. Hallucination, hallucinatory voices, and persistent delusions. And then these symptoms have to last for at least 1 month or more. So why does schizophrenia occur? As I said earlier, schizophrenia, we don't know what causes it. And there is no associated structural abnormality in the brain. Therefore, we call it a functional problem. It's not a structural problem. It's a functional problem, meaning that the structure is all fine, but it somehow just doesn't work. So the main hypotheses include a hyperactivity of the dopamine pathway of the brain. Another hypothesis is hypoactivity, meaning too low activity of the glutamine pathway of the brain. However, there is no conclusive evidence as to what exactly causes the function of the brain to go wrong and what is exactly the pathway that goes wrong. So the actual problem in the brain may be a combination of pathway problems, and the current scientific community just doesn't know exactly what it is yet. So for the cause of schizophrenia, although we don't know exactly what causes it, genetic cause contribute 60 to 80% of the risk of schizophrenia. It means that the genetic cause doesn't actually make someone schizophrenic. So for example, if a parent has schizophrenia, then the parent passes down the risk of having schizophrenia to the child instead of passing schizophrenia to the child. So it doesn't mean that, so if a parent has schizophrenia, it means that the child may or may not have schizophrenia because only the risk of schizophrenia is passed down. And so as genetic cause contributes 60 to 80% of the risk of schizophrenia, and then the remaining risk are due to environmental factors. Some factors that have been suggested include complications during pregnancy, severe maternal malnutrition during pregnancy, being born in winter months, early social service contact, and also disturbed childhood behavior, and also the use of cannabis during adolescence. And as to why schizophrenia is triggered, then stress is the most common trigger of a schizophrenic episode. So how common is it? So it is estimated that the lifetime risk of schizophrenia is 15 to 19 per 1,000 population. At any one time, about 2 to 7 out of 1,000 people have active schizophrenia. So it is perhaps more common than people think. And then we look at the investigations as to what we can do when schizophrenia is suspected. As the cause of schizophrenia is not completely known, therefore there is no definitive diagnostic test available. The diagnosis is by clinical features. So if the clinical features match with the diagnostic criteria of the DSM-5 or the ICD-10, then we diagnose schizophrenia. The reason why we do physical investigations is to exclude other causes that we can treat. So we do blood tests such as liver function, kidney function, blood glucose, blood lipid, and thyroid function, ESR, to see if there are other physical causes that causes psychosis. And if there are other causes, then we can treat those other causes. We can also consider brain imaging such as X-ray, CT, or MRI scan to exclude problems such as brain tumors. We can also do urine drug screen to exclude any substance abuse. So after excluding the physical problem, then we can diagnose schizophrenia, because the main criteria of diagnosing schizophrenia is to have no other organic illnesses. Then we can diagnose schizophrenia. And this is all from this part of the presentation, and I will give the floor back to Eva. Thank you.
Okay, thank you so much, Dr. Gordon. Okay, now thanks Dr. Gordon for elaborated the perspective of Western psychology on schizophrenia. Now I'm going to invite Venerable Langdachala to deliver a lecture about Dr. Nisanka, Buddhist Psychotherapy and schizophrenia. Venerable Langdachala, please.
Thank you. Good evening from Sri Lanka. So now I'd like to share some idea about the Dr. Nixon Kerr and his Buddhist psychotherapy and schizophrenia. So for those who don't know Dr. Nixon Kerr, I'd like to introduce who is Dr. Nixon Kerr. This is the biography of Dr. Nixon Kerr. So Dr. X.S. Nixon Kerr, he was a Fulbright scholar, obtained his MA and PhD degree from the University of Pittsburgh and Jeddah, respectively. So he was an experienced teacher as senior lecturer at the Sir John Kutawala Defense Army and a provisional editor of the Academy and also a provisional editor of the Associated Newspapers of Ceylon. So he was a visiting lecturer at our institute, the Postgraduate Institute in Pali and Buddhist and Pali Study, and the University of Kalenjin, Sri Lanka. And in that university, he conducted MA degree course in Buddhist Psychotherapy. Now, Professor Wasenter is teaching that course in our PGM-PBS. So over a period of 40 years, Dr. Nixon Kerr has treated a large number of mental patients successfully. So this is the Dr. Nixon Kerr books of Buddhist Psychotherapy. So in his book, he used a system of Buddhist psychotherapy. So Dr. Nixon Kerr developed the Buddhist psychotherapy in this name sister. He was the very first deployer in Buddhist psychotherapy in Sri Lanka. So in his Buddhist psychotherapy, the sisters are firstly the developments of communication between the therapist and the clients, the patients. And later on, there will be the deployments of body awareness by the patients by means of Kanupassana meditation from the Satipatthana Sutta. And deployments of feeling awareness by the patients by means of Vedananupassana, mindfulness and feelings. And the fourth stage is the probing into the patient's conscious and unconscious mind and bring to the light materials. It's kind of memory with the kilesa. And then they're particularly in the unconscious mind. This is by means of Satipatthana meditations. And the fifth step is the analysis of the selected material that are linked to the mental illness. The causes of the illness are made to be seen and known by the patient and by himself or herself. So that he used this practice by means of Dhammanupassana. So the final state is the rehabilitation and socialization state. So in this way, he used the sixth step of Buddhist psychotherapy. So in his book on Buddhist psychotherapy, we may see the 10 case study, different psychological disorder. So in there, we're going to use as a reference of the case of schizophrenia because it was the very first case study of schizophrenia in the Buddhist psychotherapy. And so we use this case study. So according to the case study of the Nixon Kerr, the case opinions were there was a 24 years old and a very good-looking girl. She had undergone psychiatric treatments and diagnosed as schizophrenia for 2 years. And she ran away from her home with a fear of that someone was chasing after her. She admitted to a private hospital on 20th of December 1998. Sometimes she jumped through the toilet window on the ground, which was 12 feet below the floor of the room. Then she ran away when she was looking for more than 2 hours. And finally, she was found by the police when she was hiding under the lorry packed in the bylane. So she got Western treatments was continued, but she had no good effect. So she was brought for the treatments of Buddhist psychotherapy in mid of February 1990. So when she arrived to Dr. Nixon Kerr, she got these symptoms. She had a strong suspicion, particularly directed against her own mother. She repeatedly said that she was not her mother, and then she was trying to kill her by poisonings. So she had some kind of auditory illusions of hearing voices, and also other hallucination, particularly in the night. She said that people at her home were crisping against her, and she suffered from the lack of sleep and loss of appetite, and has no sense of cleanliness. And she spoke of having had sex relations with her boyfriend and of being pregnant by him. And a short period of normalcy was followed by periods of restlessness and agitations. So Dr. Nathan Kerr started his treatments. Firstly, Dr. Nathan Kerr sent her to the gynecologist for pregnancy tests, but no pregnancy. And then she got also tested blood sugar level, blood pressures, and cholesterol, but all are normals, and also have an ears attacks, kind of blood test. That indicate that she had no social diseases. And later on, Dr. Nathan Kerr deployed confident in the therapy. It was his tremendous step of psychotherapy. He used the first step. It means that the problem communication between therapist and counselor. So he used that first 3 steps together, the problems of communications and also body and feeling awareness by means of Anapanasati Bhavana. And that contemplation on the mind, Chittanupassana, he used that to probing into the both conscious and unconscious mind and for diagnosis. So he used the techniques of free association, the Freudian techniques, free associations. And then he got several memories. That several memories were drawn out, including the following, like visions or fearful Citta Gavesi emerged through the locked rooms, and hearing some noises of some strange people conspiring to kill her, and being fragments of Citta Gavesi. And then the patient was yelling out, and then sometimes even during the daytime. So she believed that her mother had hidden a Chen means the black magic in Sri Lanka. They call it Huni Yama, and her back. So there were some quick response when the patient got some words such as accidents, mother, fathers, and poisons. All these words indicate that her childhood has not been a happy one that Dr. Nathan Kerr considered. And there were some dreams by means of dream analysis. She felt that someone was following her, and therefore she ran away from her home until she found that she have come to the edge of the road on the riverbank and could not run anymore. At that point, she woke up from the dreaming sleep. So that dream indicates that there was a deep-rooted fears and suspicion in her unconscious. So treatment continued. Dr. Nathan Kerr continued the treatments, and she got encouraged to continue meditations on her bodies and feeling, at least a few minutes every morning and evening. And her own suspicions and fear with illustration created a catharsis in her. And Dr. Nathan Kerr encouraged to stop medications, that means the psychiatric drugs, gradually. After about 10 sessions, she was able to manage herself without drugs. So there were personality analysis and memories and emotional analysis. So Dr. Nathan Kerr used personality analysis methods. He said there are 4 types of personality analysis, personalities out of 6, because the 2 are not problem he considered. So out of 4 personality type, she said that she belonged to the mixtures of raga and dosa personality. That means the desires and hatred types. By means of further questionings, helped to realize that she was belonging to the moha also. So the personality type driven by her own ignorance of realities. So analysis of her memories and emotional responses revealed that the major kilesa that caused the illness were suspicions, that we call the Pali is a Vichikitsa. It was also revealed that the kilesas or suspicions were trackable to even as far back from her childhood days. So the patients were given the following clear instructions by Dr. Nathan Kerr. Whenever she had or saw hallucinatory visions or fearful noises, she should remember, say to herself that kilesas or suspicions have arisen myself in her. I mean, when an impulse to accuse her mother came as, she might say that the kilesa or suspicions was behind the impulse too. So patients were prevented from seeing her kilesas or suspicion because it had been covered by the nivarana, we can translate as the hindrances. So the hindrances or kamachanda or or desire for sensual pleasures and sexual needs, which is a psychoneurotic conditions, or having her mind preoccupied by sexual thoughts all the time, except when she got fearful hallucinatory visions. It's kind of, defense mechanism for her. At the time, tell her that Kamachanda has arisen. So the patient was encouraged to visit the place of religious workshops or kind of temples and monastery, and the time she should sit under a Bodhi tree in the temples, and encouraged to spend even a few minutes there to meditate or meditation on breathing meditation. So threefold or Anapanasati Bhavana. And meditations on breathing and on full mood or behavior, idiopathic, walkings and standings and sleepings and sitting meditation will lead to the development of full awareness as given in the Satipatthana Sutta. So the development of the Manupassana help the patients to manage herself. 4 years later, on the January 2002, the patient was a quite normal person. She have completed a course in preschool education and also studying a BA degree as an extended student. So this was the first case of schizophrenia treated by means of Buddhist psychotherapy by Dr. Nick Sankar. And Dr. Nick Sankar said thereafter several cases of schizophrenia were treated with more efficiency and confidence. So this is Dr. Nick Sankar, his Buddhist psychotherapy and schizophrenia. Later on, we will do some revisiting. Thank you. I'm going to deliver to Eva now.
Okay, thank you, Venerable. Okay, thanks, Venerable Nandachara, for delivered the perspective in Buddhist psychology and schizophrenia from Dr. Lee Sankar, Buddhist psychotherapy and schizophrenia. Now, let us move into the next part of discussion. 3 speakers will discuss together. First, please, Professor. Professor?
Yes, thank you, Eva.
Yeah, please
Okay.
invite you for discussion part.
Okay. So, thank you very much. Actually, though Dr. Nisanka has mentioned that he used this Buddhist psychotherapy to deal with the schizophrenia issues, but the methodology is not so far clear. It's okay that he mentioned he used 6 kinds of steps, but we need to further understand that what kind of methodology. We know that there are some kinds of considerable discussions that meditation is not so good for this sort of schizophrenic issues and so on. As Dr. Gordon mentions, we see that there are kind of somatic, kind of biological, physiological effects towards the schizophrenic issues. So then, how really we can use this Dhamma therapy to heal or to recover or to get rid of the schizophrenic issues? Then you are expected to understand very clearly the Buddhist psychological understanding on suffering first. So then I would like to draw your attention towards the Buddhist psychological understanding on suffering. Without having comprehensive understanding on this suffering, I think we cannot deal with the schizophrenia. That's why I try my ultimate best to explain you the Buddhist psychological understanding on suffering. So there are a lot of kinds of considerable discussions that have been made towards the Buddhist understanding on dukkha. The popular term is suffering. But I see that there should be further explanation towards this Buddhist understanding on suffering. According to my understanding, according to my research, I see three aspects in one suffering. That's why I renamed this as triune suffering. So the authentic suffering, that is the intrinsical pain. So we know that according to the very popular sutta, the Arrow Sutta, Salla Sutta, it is very clearly mentioned thereof that when an individual is shot by an arrow, firstly, that person gets the physical pain. That is the intrinsical pain. That is the authentic pain. So, but later, we are adding our internal dynamics into this actual pain. What are these internal dynamics? So that's our cognitive, emotional constructions and compulsive behavioral patterns all come after adding these internal dynamics into this authentic or intrinsic suffering. It's not really suffering, the pain. We are developing, we are extending this pain into more suffering. Pain is really inevitable, but suffering is optional. So anyhow, I see that according to my studies, there are three types of suffering within the dukkha. The authentic suffering or a physical pain is very inevitable experience to each and every personalities in the world. According to Buddhist psychological explanations, though you are an unenlightened or an enlightened or a fully enlightened, but this pain is inevitable. It's from the Buddhist explanation. But fabricated suffering is optional. The reason is that is really our own creation, own production with our internal dynamics. So we have kind of harmful behavioral patterns and effective emotional reactions and unrealistic cognitive tendencies like perception, mental construction, thinking, etc. and etc. So due to our unlearned behavior, unenlightened behavior, we are adding these internal dynamics into that intrinsical pain. Then intrinsical pain becomes more fabricated suffering. So within the psychology of Buddhism, it really addresses to this fabricated suffering. And other part is, so we know that when it comes to the fabricated suffering, there are kind of classic suttas like Lokachinta. So when you read in your lesser times this sutta, you can see that as Gordon explained, there are kind of hallucinations. The visual has hallucinations. So in this sutta, it is in this classic sutta, it is said that one person, he noticed a kind of battle that happened, gods and their rival. So the rival part, to survive, they really went to their world through the lotus stalk. Suppose that there was a combat, battle. The rival part for their survival, well, they just disappear through a lotus stalk to their world. So then the context is that that's a kind of, we know that visual hallucinations. It is unbelievable. Then this person who saw this, the incident, he thinks that this cannot be happened. I think I am mad. So he explained this situation to the crowd people. I saw this sort of incident. It is unbelievable. I think I am mad. Then the crowd people also says that, yes, you are mad. Sorry. Then these people also mentioned that, yes, you are mad. when this message passed to the Buddha, Buddha says that no, that person is not mad. Because though this person is a schizophrenic person, but he really see these things. He really see these things. He really hear these things. He really tastes something, as Gordon explained. Due to the perceptions, there may be kind of neurological issues, and due to the brain chemistry, and or due to the drugs issues. So they feel, they hear, they taste unreal things as real. According to their experiences, they see it, they hear it, they touch it. In accordance with this context for the client, concerning the client's mentality, Buddha says that he really see it. He really touch it. He really taste it. According to the client's understanding, he's not mad because he see, he hear it, he touch it, he taste it. So then the answer is, regarding the wrong cognitive training, this client saw that. Regarding the wrong cognitive training, the people also thinks that he really noticed an unbelievable thing. But regarding the wrong cognitive training to the context of the client really experienced it, though it is unreal. Then Buddha says that why he is not mad? He is not mad because he is really seeing it, touching it. Why he is really seeing it, that sort of unreal thing regarding the wrong cognitive training. So this is the very important point, context we need to understand that Buddhism highly emphasizes the fabricated aspect of the issue. So the somatic aspect is up to Gordon. It's mean the medication, though they have kind of psychological, environmental, but we know that there are considerable effects from the brain. So the Buddhist part is not to deal with that point. If there are kind of supports from the imbalance of the brain chemistry, it is to be dealt with medication. But this fabricated part has been recognized in Buddhism as very dangerous precipice. This is the fabrication. Why fabrication comes into being? Due to my strong attachment to the psychosomatic mechanism or the personality factors. Due to my wrong cognitive training, being infatuated by the strong attachment or upadana or clinging, I accept my psychosomatic personality factors as myself or self-identification. So this self-identification supports for the client to fabricate that pain or authentic suffering into more fabricated, and not only to the fabricated level. So as a client, suppose there's a cancer patient, his suffering is highly affect to their parents, their neighbors, family members, loved ones. Then it becomes the collaborative suffering. In the Ambalattika Rahulovada Sutta, Buddha says that the social well-being is dependent on the individual well-being and vice versa. So the Buddhism highly emphasizes how to minimize this fabricated suffering, collaborative suffering into the authentic level. The process to minimize this fabricated and collaborative suffering into the actual level is based on threefold training. So this is the collaborative suffering. We know that the Angulimala serial killer, being infatuated by egocentric desires and so on, he totally changed the entire society into collaborative suffering. So then Buddhism aims at most probably collaborative aspect and the fabricated aspect, it does not mean that Buddhism has not considered intrinsic pain, but Buddhism almost all the time highly emphasizes that mind is the forerunner. Mind is the forerunner. So we can discuss other things later, but in the Buddhist context of the psychological analysis on suffering, most probably Buddhism has recognized three layers, three aspects of suffering. So this is the triumph suffering, 3 in 1. So Buddhism gives the treatment plan, pathway, how to minimize these sufferings and to maximize the well-being. So the pathway is really Dharma therapy. So when we are going to deal with the schizophrenia, so we need to understand its intrinsic aspect, authentic aspects, and the fabricated aspect and the collaborative. When somebody is getting used to kind of issue and has been prolongedly used to this process for a long period of time, we reconstruct, we are used to that process. Then it creates a schizophrenic brain or a depression brain or an anxiety brain. So that's the important thing. So there are kind of considerable suttas. Within those suttas, what the Buddha says that the world is within this pattern-long body. The world is centered on this psychosomatic mechanism. Within this mechanism, world is there. When you are being used to some constructions, it becomes your world. So when you have the immoral acts, unhealthful mental process, the brain gets used to that process. So, but it can be reconstructed. So then, according to the Buddhist psychological understanding on suffering, the suitable word is dukkha. Within this dukkha, there are 3 layers. Then let's try to understand these 3 layers of the schizophrenic issue. So I would like to go back to the Eva.
Okay, thank you, Professor. Thank you again for your discussing. And let's invite Dr. Gordon Wang for discussing.
Sure. So I will share my screen now.
Okay.
Can you see it?
Yes.
Okay. So now I will briefly talk about the Dharma therapy. So in the Dharma therapy, there are 3 main parts. There is Sila, Samadhi, and Panya. Behavioral modification, mental development, and cognitive transformation. So for the first part, behavioral modification or the Sila, so Western medicine is mostly to do with this behavioral transformation, because Western medicine treatments of schizophrenia is mostly biological. It is biological in the sense that medication is the most important thing used in the treatment of schizophrenia. So medication is used to balance the neurotransmitters, meaning the brain chemicals. The medication balances the neurotransmitters that are not balanced and therefore reduces the symptoms. However, medication does not cure schizophrenia and only decreases the symptoms. It doesn't cure because we don't know why exactly schizophrenia happens yet. Therefore, medication cannot cure it, but only reduces the symptoms of schizophrenia. In Western medicine, there are also psychological and social treatments of schizophrenia. However, these are more supportive in nature and also doesn't cure schizophrenia. For psychological treatments, there is behavioral activation, meaning we suggest the clients or the patients to set a timetable for activities. This is to improve the negative symptoms, the decreased motivation and volition. We try to get the clients or the patients to stick to a timetable of activities Therefore, hopefully this will decrease the negative symptoms. We also educate on the illness, on what is schizophrenia. We also educate on how to identify the potential triggers of the schizophrenic symptoms, such as stress. And then we teach how to manage these stress so that this risk of relapse is less. Psychological treatment also aims to improve adherence to medication, because many studies suggest that schizophrenic patients are often not adherent to medication. They often don't take the medication because they think they have no illness or because there are side effects. Other treatments include the social treatments, which includes ensure access to food, safe living environments, maintain socialization, and also occupational rehabilitation, so that they maintain a healthy life, healthy living environment, and also hopefully have a job as well, so that they have a fulfilling life. All these psychological and social treatments are there to support the biological treatments, which is to balance the neurotransmitters. So with that, I would hand the floor back to Eva, so that maybe Venerable Nanajara can talk about the Samadhi.
Okay,
Yeah.
thank you, Dr. Gordon. Now we are going to invite the Venerable Langachara to discuss Samadhi.
Yeah, before we start discussing about the Samadhi, I want to share some Dharma therapy process for the psychological suffering, because Professor Wasenta at the very first sessions he introduced his Dharma therapeutic process, so like listening and memorizing these things. So this is the therapeutic process of Dr. Wasenta. He developed this psychotherapeutic check. So firstly, before we go to the therapy, so we need to analyze the case, and we need to understand the case at the beginning. So based on the Dr. Nexanka case of schizophrenia case scenario, so I would like to show some sample how we can use these therapeutic checks according to the Dr. Wasenta Dharma therapy process. So after first one is the sutta. Sutta is the listening. After listening, we were understand what are the complaints of the client. So based on that complaint, we got to memorize, and that means the therapeutic reading. In Pali, we call data. So based on the complaint, what are the problems in her very life, like this, we're gonna therapeutic reading data. And then the next step is Vachata Parichita, meaning the verifying the case. So we're gonna verify whether it is schizophrenia or not. Then Manasanupakita is to visualize also what happened in her childhood and then adolescent time, what happened. So have to visualize the whole case scenario. And after finishing all these things, yeah, that will be the comprehension. So we're not gonna comprehend at the very beginnings, although the client is came with the labels of schizophrenia. So we're not gonna comprehend very quickly as the schizophrenia. No, not in this way. So that the Superior is the comprehensions, or we may say like case conceptualizations of this step. So after conceptualize the whole case scenario, we will come the therapy as like Dr. Gordon explained. We're gonna have the behavioral therapies and also kind of the mental therapy and cognitive therapies. So based on this therapeutic checks, the clients is like after listening, the clients, these are the complaint of the client. She is 24 years old, female, good looking, and married girls, and undergone psychiatric treatment for 2 years, diagnosis with schizophrenia, and ran away from her home. And she feared that someone was chasing her, and also suspicions against her mother, her parents, and also having hallucinations and delusion, lack of sleep, local appetite, no sense of cleanliness. These things we can see in the case. So based on these things, there will be the therapeutic readings. As Professor Watson said, the suffering can divide it into, can see the three aspects of sufferings or triumph suffering. These triumph suffering can divide it into three aspects also. First one is the client's harmful behavioral habits and also emotions and how the client cognition. So the harmful behavioral habits, client has suffered from lack of sleep, loss of appetite, no sense of cleanliness. These are harmful behavior of the client. Then affective emotional reactions are like kind of suspicions, her parents and imaginary sexual relationships and imaginary pregnancy. Then she considered as her mother put black magic to her, and a hatred toward her mother, fear or suspicions and restlessness and agitations. These are the 5 hindrances these are the hindrance, and these blocks her healthy mental attitudes. So these then cognition is unrealistic cognitive tendency. We can see the disorganized thinking pattern. And she had the auditory illusions of hearing voices, hallucinations, and delusion, and also ran away from her home because she considered her home is a danger for her. That's why she ran away from her homes. And these come together, and the avijja, the fundamental misknowledge, to the wall. And why these fundamental misknowledge are coming, and why she add these actions based on her self-identifications, or that we call the Sakaya Ditti. So combining these two, the kind of unrealistic cognitive tendency. This is therapeutic reading. So after therapeutic reading, yeah, we can verify the case as schizophrenia, as Dr. Nathan said, as the clients can with the labor, that's no matter. Visualizing Manasanubhakita. So we can visualize the client case as so in Buddhism, we can divide our lifespan into the 10 decades or decades, like childhood and adolescent, adulthood, each in 10 years. So when from back to 10 years is childhood, Manda. So what happened in her childhood? We need to know. We need to visualize. And what happened in her adolescence? And what happened in her adulthood? Now it's 24 years, right? So this is the visualizations of Manasanubhakita. So finally, Ditya Supriveda can mean comprehensions. So based on these harmful behavioral habits, affective emotional reaction, and realistic cognitive tendency, based on these things, yes, clients become the schizophrenia clients. Yeah, so this is Ditya Supriveda. In this way, we can use the Professor Watson Dharma therapy process. So after comprehensive case, like Dr. Gordon said, he's gonna use the therapy as Sila as the biological and psychological and social changes, behavioral changes, and also samadhi in here is the we can say attention and control samadhi. Samatha, we can say in Buddhism we also say that samadhi is samatha for what? For attention and control of the client's monkey mind. And so there are 40 samatha practices described in Buddhist practice, but we don't need to use all 40 samatha practice for the clients. So how are we going to prescribe the samatha meditations for the clients based on their temperaments, according to the client temperament? But for that, we need to do some personality analysis. So in Buddhism, especially, we can see in the Visuddhimagga, there are some kind of personality analysis method. So we can use these assessment tools to analyze their temperaments or characteristics, or we can say personality in modern time. So personalities of the client, and according to her personality, we can prescribe the relevant samatha meditation. So by means of this samatha meditation, we can enhance the cognitive transformation process. Also, we can put the client into the strict code of behavior. You see, like, if the client's mind is wandering here and there, how she can perform the behavior strictly. So samatha is very important in middle. And it is also good for the impact of physical well-being for the brain, for the blood pressures. So yeah, there's a lot of research on samatha and then physical changes and physical well-being. So to practice these attentional control samatha meditations, not very complicated. Client can use even some natural resources for her mind and body relaxation. Sometimes she can see the color, she can see the waters, like kind of natural resources. So by means of this samatha, as I said, we can enhance the cognitive transformation process. So regarding the cognitive transformation process, Professor Watson gonna explain about it. Professor, please take over the section. Do you want I share a screen or you want to share by yourself?
Please, Venerable, share it.
Okay.
Please, I cannot share. Okay. Venerable, are you sharing or myself? By myself?
Yeah,
Okay.
I thought share. You can share
Okay.
by yourself.
Thank you. I think you can see the yes.
Yeah, very clear.
So, okay, thank you very much. So then we have explained you that how schizophrenic issue can be managed with medication and the mental construction through the transformation of the mental construction. We know that, as Gordon explained, there are considerable somatic influences towards the schizophrenia. That part is to be managed by the medication. The effects from the internal dynamic acts are to be managed by the meditation. So my understanding is that meditation plus medication, this issue is to be managed. So when it comes to the cognitive transformation, in this point, I take the opportunity for you to once again rewatch the movie Beautiful Mind. When you once again watch this movie, you can see that medication is not enough. We need the empathy, we need the sympathy, and we need to have strong caring regarding the client to reconstruct this constructed mentality into these schizophrenic experiences. So as Venerable Nandacharya explained, with the help of the mental transformation, with the help of the samatha or the tranquilized meditation to transform the ill mind into healthy mind, in this process, we are helping the client to enhance healthy mental attitudes. Healthy mental attitudes. So in relation to the Buddhist understanding on the mental topography, so within the Buddhist psychology, it has its own understanding on mental topography as sensual and sexual mentality, fine material mentality, and supra-mundane mentality. So now the client's mind is within the low level. It means the sensual and sexual mentality, karma, vachara. We are all having psychological issues when our mind is in this level. So we need to transform it. How we can transform this mind? Firstly, the chemical imbalance is to be managed. So it's very clear that we need medication there, either from Western or either from Ayurveda. So we need it. So the other thing is that now we see schizophrenic brain. So though we are bringing about kind of relax from the medication, still the mind is so constructed into the schizophrenic brain. Brain is plastic. It can be changed. The serial killer brain can be transformed into Arahant brain. There should be a structure, pathway. Pathway is threefold training. So after bringing about the client's transformation through medication plus mental enhancement, then we need to provide full mind to the client. How we can really bring about the full mind? With the insight meditation. So it is a fourfold. So with the help of the mindfulness on body and mindfulness on feeling, we try to provide full mind to the client. After providing the full mind, we should let the client to understand his own mind. Without full mind, developed through the first and second mindfulness on body and feeling. This is body-based meditation. This is feeling-based meditation. Then this is the mind. Chittanupassana means with the help of first and second, the client can himself observe the mind. Then we'll understand layers of the mind. There are considerable discussions to understand these layers, but time is not enough. After recognizing how his mentality functions, then he can himself, but we need to support, we need to provide the psychoeducation, then client can understand these are the unhealthy mentalities that I have been infatuated by them. These are the unhealthy mentalities that led to my issue. There are 7. Venerable Nandacharya explained under the analysis of 5 hindrances. Within these 5 hindrances, there are 7 kinds of unhealthy mental attitudes. Instead of such unhealthy mental attitudes, we can develop healthy mental attitudes. It means 7 enlightenment or 7 awakening factors. So this is the process of having full mind. Then I would like to come to my conclusion part. This threefold training is to be applied to the psychosomatic condition of the personality. The Buddhist assumption is that everything is being changed, everything can be changed, personality can be changed, brain can be changed, mind can be changed. So, according to the commentarial exposition, morality is to be applied to the physical body, corporeality group. Then, as Venerable Nandacharya explained, tranquilized meditation is to be applied to our feeling and perception group to transform unhealthy feelings and the wrong perception. We know that according to our previous explanation, the hallucination process. And then the insight meditation is to be brought about to change mental formation and the conscious group. So it means that the entire psychosomatic personality, according to Buddhism, the term personality is not suitable. There are something that cannot be changed when we take the concept of personality from the Western psychology. Instead of the personality, Buddhism almost all the time uses the concept of character or the charita or temperament. Temperament can be changed with the help of threefold training. So here morality, under morality we are using the medication, then the concentration and wisdom, it helps us to use the meditation. So the point is that according to the schizophrenia issue, we know that there are considerable effects from the brain. But within the Buddhist understanding on brain, Buddhism gives the first place not for the brain but for the mind. Within the Buddhist analysis of the anatomical part, brain is given the last part. It does not mean that brain is not important. We know the significant value of the brain. But Buddhism highly believes that when we are enhancing our mind to optimum level, when we are evoking our potentials within the brain, mind capacity, it can change the brain because brain is plastic. We know that according to modern understanding, reptilian brain, it is the reptilian brain is responsible for the breath, heart rate, blood pressure, vice versa, temperature. So if I would like to draw your attention to the Kayanupassana, is the mindfulness on body or body scan. So when you are practicing mindfulness on body, it really helps you to calm down if you have a strong heart rate or a blood pressure or a breath, if there are unnecessary functions on this breathing process, heart rate, blood pressure, and so on, this mindfulness on body helps you to calm down such things into healthful manner. So we are, according to Buddhist understanding, we are settling down such issues which are related to the reptilian brain, not touching the brain, but enhancing the mind. So Buddhism understands strongly the reciprocal interaction in between mind and the body. But Buddhism gives the fire to the mind. Mind is the forerunner. When you are enhancing the mind, really it has considerable effects towards the body or the muscle brain. So when we are focusing once again our understanding on the limbic brain, it is really responsible for emotional function, feelings, etc. So I would like to once again draw your attention to the feeling-based meditation in mindfulness practices. That is the Vedana-Anupassana. So when you concentrate on Vedana, feeling, there are 108 kinds of feelings. Normally happy, unhappy, and neutral. Most probably when we are having kind of painful experiences, as I explained you earlier, we are extending them. But when we are mindfully observe the pain, how it comes into being, how it exists, how it disappears, we are not supporting. So this is the way we are really managing our emotional distortions. So we are going to control the emotional distortions, not with the medication, but with the meditation. This is a feeling-based meditation. And when it comes to the neocortex, we know that's the rational thinking. Actually, so when we seriously understand the mindfulness on mind elements, Citta Anupassana, and mindfulness on the Dhamma, it really helps us to entirely transform our cognition. For the first time, we understand that I am being infatuated by the unhealthy mental attitudes. Instead of these unhealthy, I really can eliminate them and enhance healthful mental attitudes. It is to be understood perfectly. When you are understanding with the practice of this 4 mindfulness practices, it helps you to transform your neocortex in the modern understanding, or to transform your wrong cognitive training into right cognition. So when you are in this way with the meditation, when you are transforming your mind, it directly affects to change your brain neural cells. This is the new learning process. You are having for the first time new experiences. When you are storing them up within your mind, it helps you to have new neural cells and to change your neuroplasticity, finally to change the whole ill brain into healthful brain. So brain can be transformed with the medication plus meditation. This is the process that we can really apply to transform the schizophrenic brain if we are using this threefold training. Really, from delusion and hallucination, we are taking the schizophrenic brain from the hallucinations and delusions to the present moment. So my conclusion is medication plus meditation, these schizophrenic issues can be resolved. For the first time in the Buddhist psychotherapy history, Dr. Nissanka has given us a very strong clue It is to be further studied. This is not the final conclusion. It is to be further studied. And I am trying with my academic colleagues to construct meditation hospital. It is not for the normal individual, but for the patients who are having the psychological issues. But we have the structure and we have the plan. If we are having kind of meditation hospital, I strongly believe that according to the Buddhist understanding on anicca, impermanency, and the flux of change, these issues can be transformed. There may be kind of genetic issues for a certain level when you watch once again the beautiful mind, but we can control. So minimizing the issue to some sort of level, we have the ability to maximize the well-being of the client. It does not mean that we are totally eradicate the whole somatic issues from the body chemistry, but we can control. So 80%, 70% can be managed of the schizophrenia issue if we are using this meditation hospital concept. That's my conclusion. Thank you very much. Eva, back to you. Eva?
Okay, thank you so much, Professor. And thanks to all of you for discussing. Now, let us move into the last part of question and answer session. The first, there is an audience, Matt. He or she asked the question in the chat box. Now, let's invite he or she ask a question. Matt.
I think Matt.
Okay. Oh, yeah, hi.
Okay, thank you. Thank you for your question. Please.
It's quite long. Apologies because it's very long and there's a few aspects, but I'll just read what I wrote down in the chat, right? So as a kind of few, maybe 2 or 3 questions included, but specific transdiagnostic factors like intolerance of uncertainty, negative beliefs, worry, experiential avoidance have been associated with schizophrenia. And there's no schizophrenia mentioned in the Buddhist sources as this concept, but mental defilements like greed, hate, delusion are mentioned and recognized a lot. So for integrating approaches like Dharma therapy with Western mental health care, do you think it would be helpful to consider these things like greed, hate, delusion as transdiagnostic factors? This is really for Dr. Wong as a psychiatrist for that. But that's one aspect. And then I wanted to also ask, would a focus on transdiagnostic factors like greed, hate, etc., rather than adopting diagnoses like schizophrenia, be a more coherent approach for the future for these kind of approaches, Buddhist-derived approaches to mental health? Would emphasis on considering things like greed, hate, delusion as transdiagnostic factors, do you think that's suitable? Or the other option, I think, could be to broaden out the approach to consider Buddhist-derived or Buddhist interventions or Buddhist therapies, etc., as like engaged Buddhism generally. So to actually consider the wider social issues, environmental issues, economic issues that all contribute to the arising of things like mental health problems like schizophrenia, because we know it's not only genetic, there's all kinds of factors, social, political, economic, all these aspects. So do we need to also have an intervention that considers those aspects more broadly on one hand, or is it useful to think about these transdiagnostic factors? I don't know what your ideas are about those suggestions, but thank you for listening and I hope it's useful.
Yes, Gordon, any answer from your side? I also would like to give an answer to Matthew.
Sure. So I will first offer my viewpoints. So for the transdiagnostic factors, I would probably say that it is important in all cases to consider transdiagnostic factors, because psychiatry at the moment is based on phenomenology anyway. So somebody somewhere sat down and decided that this cluster of symptoms is a diagnosis called this, and that cluster of symptom is called that. So somebody somewhere decided that a cluster of symptoms such as hallucinations, delusions, it is called schizophrenia. And even if the diagnostic criteria says that hallucinations, delusions lasting for more than 1 month is called schizophrenia, it is a very diverse group of illnesses anyway, because some people may have auditory hallucinations, some people may have persecutory delusions and auditory hallucinations, some people may have tactile hallucinations and delusions. Everyone's schizophrenia is different. So the diagnosis is based on the phenomenon of a collection of symptoms, and therefore the diagnosis is, so this cluster of symptoms doesn't negate the person having other symptoms outside of this cluster too. So for example, for depression, it is defined as like low mood, pervasive low mood for more than 2 weeks with some associated symptoms. But then a lot of depressed people have anxiety as well. So around 40% of the depressed people have anxiety. So I would probably say that I would probably classify that anxiety you may argue it is a transdiagnostic factor. And maybe for ADHD, then like it used to be considered that it is very rare to have ADHD plus autism, but now it is recognized as being quite common that the two co-occurring with each other. So maybe the ADHD is a transdiagnostic factor of autism, and autism is a transdiagnostic factor of ADHD. So I would probably say that it is important to consider the patient or the client's symptoms at a given point, and then formulate a management plan accordingly, rather than formulating a management plan based on a diagnosis of schizophrenia, because every patient's schizophrenia is different. Some people may be very, may have particularly florid auditory hallucinations. Some people may be very fearful because of their persecutory delusions, and every schizophrenic presentation is just different. Therefore, it is important to individualize and personalize the treatments, and therefore consideration of transdiagnostic factor is very necessary. As to your comments and your mention of experiential avoidance, so I would also say something about that. So you mentioned that there is no schizophrenia mentioned in Buddhist sources, and now we're applying Buddhist psychotherapy into Dharma therapy into treating schizophrenia, which is using an Eastern construct onto a Western construct. I think that's what you're saying. So I think there is no conflict using Dharma therapy in cases of schizophrenia, even though there is no schizophrenia in Buddhism, because when we use a treatment method, we conceptualize the case according to that treatment method. So for Western medicine, we conceptualize schizophrenia according to the diagnostic criteria like DSM or the ICD. So we conceptualize the case according to the criteria, and then we conceptualize it using the predisposing, precipitating, and perpetuating factors. We consider the biological, psychological, social factors. And while for Dharma therapy, we conceptualize a case using the mental defilements. While for, as you mentioned, experiential avoidance, so that is the buzzword of acceptance and commitment therapy. So in acceptance and commitment therapy, we conceptualize the case using the hexagon, the hexaflags. So when we use different methods, we can use different ways to conceptualize the case, and therefore I don't see any conflict in using one method on another method's diagnosis, if that makes sense to you.
I think, Gordon, we can use as a complementary approach, I suppose.
Correct. Yes. So we can definitely use like two approaches at the same time for schizophrenia. We can use the Western medicine. We conceptualize the case using the Western medicine approach, and we also use Dharma therapy, and we conceptualize the case using the Dharma therapy approach. And I don't see any conflicts, and they can both work hand in hand.
Yes, actually, as Matthew asked, within the classic Buddhist history, we don't see any interpretation towards the schizophrenia, but Buddhist approach is totally different than the Western, because as I mentioned earlier in my Buddhist analysis on psychological suffering, we really look at the suffering from more, the introspective understanding. So within that understanding, we are not going to really discuss the authentic, the suffering or the actual pain, but how through our internal dynamics we fabricate. So we can really help from the Buddhist understanding to manage that fabricated and collaborative aspects. As I think I can really understand and feel the sense what the Matthew said. I think, yes, as Gordon explains, as a complementary approach, I think I would like to share my understanding. I know that the origin of the Western psychology, so we know that a lot of scholars, they are really from the medicine, neurology, and so on. So in the Buddhist approach, we don't see it's really comes into being through more meditative experiences, introspective experiences. They have their own approach to understand through that spiritual, emotional, psychological way. So that's why the five hindrances are there. That's why Buddhism tries to understand three layers, and Buddhism more comprehensively gives the answers and treatment towards that collaborative and fabricated suffering as well. So to minimize such levels, I think the Buddhist approaches can be used. As a complementary approach, I think we can use Western and Buddhism to give a more successful benefit towards these psychological issues. That's my answer, Matthew. Okay.
Okay. Thank you, Matt, for your last questions, and also thanks Dr. Gordon and the professor to answer. Any other questions? There are some questions from online magistrate. Now I behalf them to ask question. The first is Xiaoming from China. He or she asks, how can Dharma theory of psychological treatment apply to clients with different social background?
Yes, actually, Dharma therapy is universal. So I think, as I explained through my research, I explained the Dharma therapy approach. It can be applied to any social, religious, cultural context, because we are really trying to understand psycho and somatic complications, issues of the client. So we are human beings. We have this, the psychosomatic, the mechanism. So I think it can be applied universally. So I would like to once again recall what the Carl Jung said. So he says that the Buddhist way of understanding suffering becomes universal. Universal, it can be applied to any context. That's the answer.
Okay, thank you, Professor, for your answer. Any other questions, everyone? Now, if no questions, I'm continuing to ask a question from online chat. And there is other friend from Sri Lanka. Name is Kamani Samlako. He or she asked question. what are main trigger points to this mental illness? Is it more physiologically? Is it more physiologically? Thank you.
So perhaps I'll answer this question. So
Thank you,
schizophrenia, so the cause is not known yet, but we know that the genetic factor plays a big part. So the person's genes, they inherit the tendency to get schizophrenia. Together with stress in later life, then there will be then there can be a schizophrenic episode. So it's genetic factor plus stress. So when you say it's physiological, then I would probably say yes, because genetic factor is important, as 60 to 80% of the risk is attributed to genetic factors. So I would say it is physiological. Physiological factors are very important. Thank you.
Okay, thank you, Doctor. Any other questions? If anyone have a question, please raise your hand. Bhikkhu Sopaka, please.
Thanks for this invaluable and interesting presentation, lectures, or discussion. My questions should be raised to our dear Professor Dr. Wasanda. In his presentation, he has already mentioned about the brain. Here, what I want to know is that in the how should we understand early Buddhist view on brain? As we already know, in Mahāvāga Pāli, there is a brain operation has been already mentioned, but in the early Buddhism, regarding to contemplating 31 or 32 Dvita Sakaya Nupassana, in early Buddhist teaching, we cannot find out Metalunga or brain. Therefore, how should we understand early Buddhist view on brain, dear Professor?
Okay, my answer is no need to understand the brain in early Buddhist teachings. No need to understand the brain. More important thing is to understand the mind. So understanding the brain process is up to Dr. Gordon. This means what I am trying to say that since at the Buddha's time, there was a very highly developed, the medical system. Buddha did not want to talk about such physiological thing, though Buddha has been named as great physician and great, Bisakko and Sallakatta, great surgeon. It means that why Buddha has been known with this, the great terminology is to emphasize how really Buddha analyzed the mind. Kamma, papancha, vitakka, chitta, mano, viññāna, kamma, papancha, manasikara, sanchetana. So this is the Buddhist way of analyzing not the brain, mind. So analyzing the brain, understanding the brain is up to the medicine. Here, I think Matthew's question is very important. So the thing is that the Buddhism supports, your question is really appreciated. It's very important question, Venerable. I know that what you are asking this question, I see the figurative meaning behind that. No need to, it does not mean that no need to study the brain. So brain study is up to another disciplinary. It's up to the royal physician Jivaka at the Buddha's time. He really did it, as you mentioned, brain surgery in the Mahāvāga. Buddha made the surgery on the mind. So mind surgery, the great mind surgery, that's the mental topography. We are trying to understand the issue, the great issue that led to the triune suffering. So then it becomes more important to analyze not the brain, but the mind. That's why in the commentarial exposition, brain is given the last part. That's my answer, Venerable. Are you satisfied?
Thank you, sir. Thank you, sir.
Yeah.
Okay. Thank you, Venerable Sopaka, for question, and thanks, Professor, for answering. Any other question? Please raise your hand.
Can I ask one comment? Can I ask one comment regarding brains? I found one sutta, not actually not a sutta in the Jatakas. I found one usage of brains. So according to my research, I found there was a usage for the brain as the Pali term is lassi. Lassi for the lassi in the Jataka. I can mention the Jataka both Facebook or Jataka page number 493, and in there we can see the one Pali paragraph like lassi sate nepalita metakosa padalito. So in that Jataka was Sora Jataka. So if we can consider the Jataka as the early Buddhist text, so we can say that in the early Buddhism also there was a usage of brains. How do you think, sir?
Actually, Venerable, but when it comes to the Sutta literature, most probably, if we consider it as the early Buddhism, there are considerable debate on early Buddhism. But most probably, according to my studies, I see that Buddha really wanted to make a surgery on mind, because the brain is up to kind of, the physiological, it's really up to the pain. But Buddhism understand that when you enhance your mental potential to the optimum level, there is a considerable effect even to manage the physical pain. Because we know that in the Buddhas, the Mahaparinibbana Sutta, Buddha had to encounter with unbearable pains. And even in the Samyutta Nikaya, we know that when the Moggallana and Sariputta and Buddha, even they did not really use the the medication, but enhancing their mind to the optimum level, they had suppressed their pain. So it means that Buddhism tries to give a kind of new psychology for the world, because at that time there were very highly developed medicine process. So Buddha points out that there is another way to manage this pain regulation with the mental enhancement. That's why Buddha is not going to give the fire to the brain. But the Buddha's main focus was to reveal us the potentials within our mentality and to enhancing them to the optimum level. That is the main scenario what the Buddha really wanted to explain us.
Thank you very much, sir.
Yeah.
Okay, thank you so much, Professor, and also thank you, Venerable. And we have another 5 minutes for question and answer. Now I invite Thang Kung In to ask question. Hello.
Hello.
Okay, please. Thank you for question.
Actually, I have two questions. For the first one is for the Mr. Golden one, and it is about 2 or 3 years when my friend said she heard the voice from the object, like when she threw her phone on the bird, and she heard like, why did you threw me like this hurt? And when she drained the glass and put it on the table, and she think the glass stuck to her. Why did you put me like that on the table? And this happened since I think it was about 16. Yes, when she was 16, she still heard this thing, and now she is 19. Yeah, she is 19, and it can be decided as the symptom of the schizophrenia. Schizophrenia, yes, that's my first question. And the second question is the symptom, or is the depend, it is depend on the knowledge or the how smart he or she. Like if he or she has the higher IQ or knowledge, is the station of the client is bad, or like when the treatment is when he treat like this, it is easier to recover from that symptoms. Like if he has the better IQ or knowledge, and when he treat, if he has the higher IQ, his recovery can be better or faster.
Okay,
Thank you.
so I will. So first, the question is, your friend has heard voices of the mobile phone talking to her, complaining that why she put the phone onto the table, the glass table. Did I hear that correctly?
Yes, yes.
Okay.
Not even on some other object.
Right. So that would be one symptom that is suggestive of schizophrenia, but but to make a diagnosis of schizophrenia, we'll need to probably have more than just one symptom. So a doctor would probably ask for more information. So apart from the voice from the mobile phone talking to her, whether there are other strange experiences as well. Whether she's hearing voices not connected with the mobile phone, whether the mobile phone is doing other things to her too. So probably more information is needed in order to establish a definite diagnosis of schizophrenia. But it is certainly suggestive of schizophrenia that the phone is talking to her and complaining that she put down the phone onto the glass table. So it is suggestive of schizophrenia. And the time frame is also compatible with schizophrenia as it is over 1 month in duration. So the second question is the IQ. So I don't think higher IQ leads to quicker recovery. So recovery is more, or in the Western medicine perspective anyway, in the Western medicine perspective, a remission of this schizophrenic symptoms is very much related to adherence to medication. So medication decreases symptoms of schizophrenia, but the decrease in symptoms doesn't last very long. So studies suggest that even if someone took medication and they become well and the symptoms of schizophrenia subsided, then if they stop taking medication, then the symptoms will very, very likely recur again within 2 years. So the recovery is very much related to whether the person continues to take medication or not. So you can argue that a person with high IQ is may be more able to recognize the symptoms of relapse, may be able to do more things that are conducive to health. But so far, I don't think there is any evidence that high IQ, people with high IQ will have a quicker recovery in schizophrenia.
Sheila,
Okay.
there are other questions?
Thank you, Dr. Gordon, for answering and thank you questions. And now today the time is finished, so I'm going to do a brief conclusion. We are looking forward to the further completion of Buddhist psychology, psychotherapy, counseling, and Western psychology as a supplement and enhancement to modern psychology, to contribute to modern psychotherapy and counseling. This is one ambition of Citta Gavesi Center. So finally, on behalf of this entire audience, I want to appreciate three of you, Professor Vasanda, Venerable Langdachala, Dr. Gordon Wong, for your wonderful lectures and discussions. And thank you all for your participation. We will host online lectures monthly. For further information, you can follow our Facebook, Citta Gavesi's Facebook, Venerable Langdachala posted to the chat box. Okay, thank you, everyone. Good night.
Thank you. Thank you.
Thank you.
Venerable, shall we wait for
Okay.
Eva and okay.
Thank you.
Gordon, thank you very much. Venerable,
Thank you very much.